That is going to affect a lot of people out there trying to get Social Security, Medicare, Medicaid, and all the rest of it. This is something that nobody's really talking about. I haven't seen anybody talk about this. The stimulus check. Okay, the tariff stimulus check. I give it about a 10%. It's got to go through the House, got to go through the Senate. It looks like the Supreme Court might kick that back and they have to return that money. So about a 10%. But there's a 100% chance that that stimulus check, the talk of a stimulus check, is going to affect a lot of people out there. And that's what we have Sarah here today. If you're new to my channel, this is what we do on a daily basis. We help people out throughout the country navigate Social Security, Medicare, Medicaid, SNAP, ACA, and all the rest of it, and answer your questions. My name is Ed Weir. I ran the third business Social Security office in the country, and we've got Sarah here from Chapter. And what we do here is help you navigate the bureaucracy. And the problem with stimulus talk is that what happens is, as soon as they start talking about that, then people start calling Social Security and say, where's my check? Where's my money? Where's my money? I just got my direct deposit and I didn't get the $2,000 that the president said I was going to get. And the problem with that is that it slows everything down. There's 10,000 people every day turning 65 years old. A lot of people getting laid off, and they need their Medicare. And they try to call Social Security, get signed up for Part A and Part B, or survivor's benefits or disability benefits. And the Social Security employees who are already way, way low, the worst they've been since 1935s in terms of staffing, they're answering calls all day about the stimulus check. So let's not call about the stimulus check. I always say, for the last few decades, anytime they talk about stimulus check, if you know you get it when it's in your bank account. Before that, then don't spend it. I know it's in the Constitution that we as Americans can spend money before we get it, but let's not this time. All right. So the important thing is, a lot of people are not going to get the help they need out there with all things Social Security, Medicare, and Medicaid. And so that's why we put our team together here. Includes our illustrious Sarah from Chapter, and her team do some awesome stuff. So thank you for joining us, Sarah. How you doing today?
I'm doing well. It's great to be here. Glad to be back.
I'm sure it's a nice little break from the craziness, right?
Yeah, it is.
All right. So for those people that don't know it, that we're in the annual enrollment period, which starts from October 15th and goes to December 7th. And Sarah and her team probably got 3 hours of sleep in the last few weeks because there's a lot of people out there that are reaching out to Chapter. And I don't want to discount, we've had Ari here a few times, and I don't want to discount him and his team. Those are the people that help help people find the best Medicare plan for them for 2026. They do an awesome job, but once they find the best Medicare plan for you, for everybody, then the important thing, I would argue, don't tell Ari I said this, but the important thing is Sarah and her team. What kind of stuff do you help people the other 365 days of the year?
Goodness. I mean, all kinds of things, ranging anywhere from issues that you have with billing for like your premiums on your plan, like what you pay monthly, or let's say something was billed incorrectly to the insurance company by your doctor. We help out with all of that. We just make sure that we're able to help you find like dentists or vision providers or regular doctors, or maybe a heart doctor or a lung doctor. We help you locate those in your area. We help you set up accounts with your insurance companies so that you're able to access your plan information online. Gosh, there's so much that we do. It's hard to name all the things.
Perfect.
Yeah.
All right. So let's get into that. And if you got any questions, this is a live Q&A. So if anybody has any questions on any of all that, the Social Security questions, I normally answer Social Security questions, help people, get disability benefits, survivor benefits, retirement, and all that kind of stuff. But since our focus today is on Medicare, we'll try to stick to Medicare unless we see something super, super important that I need to answer. But one of our regulars, Tammy, she also goes by Ann, who actually we found several $100s more a month for her. So, and she has a question. She's having a problem with telehealth, and I understand that telehealth was really, really expanded during the pandemic, but now they're pulling that back generally. But are there exceptions for people like Tammy that really need that help?
There are for telehealth services. So on Medicare's website, it does say that like people who are ESRD or like they have end stage renal disease, kidney issues, mental health issues. These are just some examples of what is covered for telehealth, or if you're in a rural area and it's hard for you to access healthcare.
Okay, so they are making exceptions, just like I always tell people on Social Security, there's over 20,000 pages of policy, and there's exceptions, the exceptions, the exceptions on pretty much everything. So
Mhm.
they are making some type of exceptions. So how would she get it if she's a member of chapter? If y'all help sign her up, then she's a member of chapter, and then she just calls you, and y'all fight for her telehealth, right?
Yes, yeah. So some Medicare Advantage plans will offer that as an additional benefit. Like there aren't the same restrictions as there are if you have like original Medicare for that. But yeah, we are able to assist and find telehealth doctors as well that accept the plan or accept Medicare.
Okay, perfect, perfect. All right, but if she doesn't, then what do you recommend? If she can't get your help, what do you recommend she do? Just reach out to whatever Medicare Advantage plan and try to make that exception?
We like to reduce contact with insurance companies, so like we're going to do what we can to find to
Right.
find what she needs. Yeah,
Oh, okay. So through
Mhm.
the actual doctors themselves rather than dealing with the insurance companies.
That's correct.
Okay. Okay.
Yeah.
Someone says, Sonia, so far I've received 3 calls that I have Medicare money left over for 2025 that I can get reimbursed. I know I didn't go to the dentist in 2025. Could that be it, or is this a scam? This is the first time I think I've heard this year of, yeah, that in previous years that was kind of a scammy type thing. But have you heard anything on this? Reimburse Medicare money?
Yeah, so some insurance companies like Devoted, they have their dental benefits set up as a reimbursement. So they may be
Oh,
contacting for that.
oh, okay. So
Yeah.
Sonia, I think what Devoted is in big in California and some other, but they're not nationwide, right? That's still
Right,
kind
they're
of localish.
available. Yeah, there are I mean I can't count how many states that they're available in. They are available in a lot of states, a lot more than in previous years, but
Oh,
mhm.
okay. They're expanding. Oh, okay.
Yes.
So they have so for instance, they send $2,000 a year or something like that. And if you don't use it, they reimburse a certain amount of that.
No, it's just if you happen to use the benefit, you can submit for a reimbursement for it. Like, there's no network restrictions on dentists, you can see whatever dentist you wanna see. You would just pay upfront and then submit the reimbursement. We
Oh,
help with
okay.
that too, like,
Oh,
with our
okay.
members that have that. Mhm.
Yeah, this one it looks like it's leftover money um, that didn't use the dental, and then it sounds like she's talking about, I've got $2,000 of dental, I didn't use it, and now they're calling me and said I can get that money back. I don't think I've heard that one.
That part is a little scammy. That's some misrepresentation for
Yeah,
sure.
yeah. I think yeah, I've heard of these in previous years. This is the first time I've heard it this year. That yeah, in any that's it's kind of like the lottery type things, and oh, you've got you're part of this class action suit, and so if you give us $100 or $500, we'll help you get that $10,000 reimbursement from whatever. So yeah, Sonia, I would be very, very, very careful on that one. Don't call the number on anything like this. Don't call the number they give you. Don't click on the website they give you. Same thing with Social Security. People says, "Oh, you've got you get an email that looks like it's from Social Security. It's got SSA.gov or slash. They kind of manipulate it a little bit." And they say, go ahead and log into your account because we've got a very, very important critical thing that might stop your benefits. And so you click on that, you think you're going to your My Social Security and you're going someplace else. So if you ever get anything like this, including this, say, oh, okay, that's interesting. Delete and then
Mhm.
go to ssa.gov or go to whatever insurance company you have and say, hey, what's the deal with this? But this is important though. This is one of the things I did yesterday that people need to do immediately is if they have dental benefits, because those dental benefits don't carry over till next year, right?
That's right, yeah, the benefits will reset at the beginning of the year.
What type of, so you got to use it by December 31st.
Right. If you don't use it, you lose it.
All right. So go out there and schedule an appointment. As I always say, if you've got $4,000 of dental work and you've only got $2,000 in your account, do the bottom half by December 31st, do the top half after January 1st. Make sure you don't want to be stuck out there in the wind. Make sure your new plan that you signed up for does have dental, the $2,000 to cover you for the other part. Do you see any trends on dentists, people dropping out, the Medicare Advantage plans? What type of issues do you see with dental benefits in these plans?
I wouldn't say an issue. I would say more of an inconvenience that I'm seeing. So kind of like the trend we saw last year with plans, the benefits are decreasing for dental. A lot of plans are getting rid of the comprehensive aspect to it. So these are things like dentures or extractions. Those that sort of coverage is not as available as it once was, and it's just basic coverage. So like your regular periodontal cleanings are being covered. Plans that do have like a higher comprehensive benefit allowance typically have higher copays. So there's more than likely going to be a trade-off going into the new year for benefits.
Yeah, I think there was a small trend on implants, that some companies were covering some level of implants, and those things are crazy expensive to begin with. So if they're just going back to basic cleanings now, a lot of these companies, they're definitely not going to cover implants, right?
Most of them are not covering implants. That's correct.
All right. All right. What about prior authorizations? So that's the big thing on Medicare Advantage. For Medicare Advantage, you've got two issues that you have to deal with. One is the networks, which Sarah already mentioned that, she helps people, the members. If you lose your doctor, your specialist, or whatever the case may be, and you're looking for in-network, you can't find one, you can reach out to Chapter and they find, I guess last time you mentioned you were even scheduling appointments for people, right?
That's correct.
Okay, awesome. So that's the issue with Medicare Advantage, is those networks. And those networks, do you see them kind of declining a little bit? Fewer and fewer doctors taking Medicare Advantage?
It just depends on where you live. I was actually looking up a health system for a member the other day and saw that like they're pretty much not accepting any Medicare Advantage plans for primary care, which is a huge disadvantage to the population that live in that area.
Hey, if you need help with Medicare, Medicare Advantage, Medicare supplements, Part D plans, make sure you reach out to my partners at Chapter Medicare. I looked for a place that would help you all out, and Chapter Medicare knocked it out of the park. They've got excellent customer service. They look at every single plan in your area, and their help is always 100% free. Give them a call and they'll see if they can help you out, and tell them Dr. Ed said hi. Yeah, a lot of people call it Medicare Advantage, Medicare Disadvantage, specifically because of that, because of the limited networks and kind of the nickel and the dime and all the rest. Nona says, hi, Sarah, great to have you here. So Morrissey, and you see how they typed out Morrissey with like 15 E's.
Yeah. Somebody actually quoted you on the disadvantage the other day. One of our members
Oh,
did.
okay.
I thought that was a little funny.
Yeah. Oh, I use some words sometimes and I forget I use them, like the golden ticket that people get when they got denied their PPO plan, when their PPO plans have been canceled. They get the letter and says, okay, well, thanks. It's nice knowing you, but we don't want to give you this Medicare Advantage. We're pulling out of the entire state or the area. And I always called that the golden ticket. And then someone said, hey, I just got a golden ticket. I'm like, what's that? And I'm like, oh yeah, that's right. I talked about that yesterday.
Yeah. Don't throw those away.
Oh, yes. Don't throw those away. Absolutely. So, so the other part of Medicare Advantage is the prior authorizations. You see any type of trends on prior authorizations? What are people giving you a hard time about?
No, actually, this is something that we've seen a lot of improvements on, and some of the insurance companies are taking like charge in that next year, where they're not requiring as many prior authorizations for certain services. So I'd say that's going in a more positive direction with some of these insurance companies.
Yeah, the government was going to come down and regulate, and I think some of the insurance companies, rather than that, they kind of promised they will do better. I think that was the deal. And so as of right now, maybe, depending on the area, right?
Dependent on the carrier. Like, Humana has made some really big changes with prior authorizations for the better. I believe they recently partnered with MyChart, so they're able to have more of an open line of communication with providers that are contracted with Humana.
Okay. Let's see. Someone says, let's see, I called Chapter and kept same insurance, but better coverage. Dental, medical, eye care, and Advantage card added $125 per month and covers all co-pays. They were okay, cool. Yeah, a lot of people don't realize that is they say, well, I like the company I'm with. Okay, fine, keep that company. But there are several plans, each, I think, pretty much all throughout the country. Generally correct, except for some places out in the middle of the desert that have, one one company, one plan. But most other parts of the country, you have those big players that have multiple plans in a particular area. So if you really, I mean, for whatever reason, you really love the company, fine, keep the company, but switch to another plan if that company has a plan that is better for you. They come out with quite often new plans every single year. And yeah, a lot of people don't realize that.
Yeah.
All right. We see any other questions here on authorizations, network, fighting doctors? So you see some doctors kind of giving up on Medicare Advantage plans. I know, was it the Mayo Clinic already stopped accepting Medicare Advantage, right?
Mm-hmm. That's right.
Yeah. Yeah, so it's like I was going to mention that the Secretary of Treasury already kind of backing out of the stimulus thing. So please, when we get the check, when you get it in your bank account, then you know you got it. But please don't call Social Security. It ruins it for everybody else. We've got, in terms of signing up for Medicare, when it's automatic. If you're 65 years old and you're already receiving benefits, you don't have to do anything. About 100 days or four before you turn 65, Medicare will send you your card automatically, Part A, Part B. Are you seeing people having difficulties with declining Part B once they're signed up automatically at 65? Because I think when you get the packet in the mail with your A and B card, you can refuse Part B if you have health insurance from current work, yours or your spouse's, 21 employees. And I haven't noticed any issues in that regard, that they don't have any issues denying Part B. Do you see anything?
No, I mean, the only instances I've seen that is like they're outside of an enrollment period. It's like they're out of their Part B SCP